Welcome back to DNC Live. Here's some good news. The FDA voted to recommend emergency use authorization for the Pfizer vaccine for the age group of children 5 to 11. Many are anxiously awaiting that protection for younger kids to cut infections and also to help keep them in school. So what can parents expect? And when can they expect to get that shot? The vote was the first step in the review process to get shots into arms. Joining us now to answer those questions, Dr. Patel. He is with WellStar Health System. Dr. Patel, always a pleasure. So FDA panel unanimously recommending Pfizer's vaccine, again, for that age group 5 to 11. Is this a game changer?
Absolutely. Every step is a game changer for us when it involves the kids. So 5 through 11, probably next week, the CDC will look at the data, and then maybe late next week, we should be able to get shots in arms for 5 through 11. It's a really big step for us.
All right, so 28 million kids would be eligible for that shot. Could kids be protected by the holidays?
Absolutely. It's a 3-week schedule. If you start vaccinating early part of November, definitely by the Christmas holidays, a fair number of children will have vaccinations and have immunity.
All right, Dr. Patel, also myocarditis, still a concern for some parents, especially of minority children. Can you just tell us more about that? And should they be concerned, better yet?
Great question. There were 2,250 people in the study. 1,575 got the vaccine. There were no evidence of myocarditis. There was no evidence of muscle inflammation, no severe effects. They did 4 prospective data runs as well, which means they did some modeling in which there was no other issues of myocarditis. And you have to remember, this vaccine is 1/3 the dose of what 12 to 18 or older are getting. And so it's also a smaller dose. So that may be contributing to the fact that there's no myocarditis, which we were seeing mostly in men at a higher dose. So there's also that. And then the other thing is while communities of color have historically had some hesitancy for the vaccine, this is a time for dialogue, communication, and being open-minded, as this, we said earlier, is a game changer. We could be protecting many of these children. Last week, 118,000 new pediatric cases in America.
All right, well, speaking of vaccine hesitancy, and I know there's still, 64 million eligible adults who are holding out. A Kaiser family study recently announced that 1/3 of parents are also holding out on getting their child vaccine. Do you think that vaccine hesitancy could possibly lift for parents once the FDA gives full approval?
I hope so. I think this is one of those times where you got to continue to look at objective news media like ourselves and not be in these backroom forums or these chats where they're spreading a lot of misinformation. I think that's really important. Having an open mind around this is also important, not putting politics first and putting, the future of our country, our children first. And then, the other framework I look at this in is do as I say, not as I do. But, one thing I definitely know is pediatricians and Trick Daddy, they both love the kids. And all the pediatricians I know are vaccinating their children. And so if I'm following my pediatrician's advice, I'm definitely vaccinating my kids.
Patel, you have me looking at you in a different light. I had no idea you liked Trick Daddy. On a light note.
I mean, red bottom shoes, Trick Daddy, cocktail parties, it's different here.
You know what? And I'm with it. But on a serious note, what do you say to folks? Because I get the tweets and folks are saying, hey, stop shoving this vaccine down my throat. It came out too fast. What do you say to those people who are still hesitant and don't plan on rolling up their sleeves?
I think you have to have a dialogue and communication. Like we've talked about earlier, we have to extend everyone some grace in this. This is hard for everybody, right? I'm impatient. I want you to get the vaccine. You don't want to get the vaccine. Let's extend each other some grace and have open dialogue. But what I would say is, how long do you need to wait? What do you need to see? Help me understand what it is that I can help you come across this barrier that you may be having, personal, emotional, or political even, that is preventing you from protecting yourself, your children, and protecting me. I'm your neighbor. I'm part of your community. I'm part of your country. What is preventing you from protecting me? right? Am I not my neighbor's keeper, right? Or my brother's keeper? Am I not that? And so, where is that in this? We're one community. It takes 80% to get to herd immunity. We've not even heard about that anymore.
Yeah, we haven't. And I think something else we've lost sight of is how many Americans we've lost to this virus. Do you think folks are just COVID fatigue? We have about 40 seconds, Dr. Patel.
I think there's COVID fatigue. Things are opening up quickly. They're returning back to their lives. And it's so easy to forget. But as somebody who's actually lost someone, or someone who's suffering from long haul syndrome, or has some complications from COVID, talk to their families and see the experience that they're having. It may be very different than those going to watch Georgia football, 100,000 people on Saturday without masks. Two different worlds.